When you listen to communities and you hear what their understanding of the issue is and their understanding of the solutions, you get some very innovative solutions. We were not just sort of listening and only following the lead of the people that we were listening to. So it's actually really unique. They didn't understand maybe the science of it, but they understood the community. And so it was those kinds of solutions that I really appreciated and really came out of this way of working with people that recognizes the expertise that people in communities have. And in fact, one of the sayings I have is inherent in every community is the wisdom to solve its own problems. And so when I come at problems that way, what I understand is, sure, I have something to bring as a psychologist, got lots of training, but communities also have very important solutions and understanding.
Have you ever noticed that some of the best ideas come from unexpected places? Your next breakthrough may come from a leader facing similar challenges, but in a completely different sector. Welcome to Chief Influencer. I'm your host, Anthony Shop. Join us as we explore how today's successful leaders inspire, influence, and connect with others. Chief Influencer is a production of Social Driver and the Communications Board, who have teamed up to spotlight how great leaders and communicators are making their impact in the world. This episode is brought to you by the George Washington University's College of Professional Studies. With in-person and online programs, ranging from master's degrees in public relations strategy to certificate programs in digital communications, GW offers more than just the credentials to help working professionals get ahead. It prepares them to be leaders in their field. As a proud GW graduate myself, I can attest that faculty members combine academic rigor with real-world lessons that can't always be found in textbooks. Check out cps.gwu.edu for more information.
I'm thrilled to introduce today's guest, Dr. Arthur C. Evans, Jr., the CEO of the American Psychological Association, which is the leading scientific and professional organization representing psychology in the United States. Before we dive in, here are 3 things I think you should know about Dr. Evans. Number 1, the American Psychological Association's mission is consistent with Dr. Evans' life work as a psychologist and as a leader. With more than 158,000 researchers, educators, clinicians, consultants, and students as members, the APA promotes and disseminates psychological knowledge to benefit society and improve lives. Number 2, before joining APA in March 2017, Dr. Evans spent 12 years as commissioner of Philadelphia's Department of Behavioral Health and Intellectual Disability Services. I say disability because they intentionally capitalize the A in that. In that post, he led the transformation of the agency's approach to serving a wide range of individuals with complex needs. The transformation of the $1.5 billion Philadelphia system has relied heavily on public health strategies that contribute to better community health. And number 3, Dr. Evans has been widely recognized for his work bridging policy and practice, including the American Medical Association's Top Government Service Award in Healthcare and the National Alliance on Mental Illnesses Recovery Model Award for his innovative work in behavioral health services. Dr. Evans, Arthur, you have been called many things in your career, including an advocate for action by the White House, a visionary leader by the National Council of Behavioral Health, a humanitarian by the Society of Biological Psychiatry, faculty member at Yale and other prestigious institutions, commissioner for the city of Philadelphia, and of course, CEO of the APA. Well, today we are thrilled to call you a chief influencer. Welcome.
Thank you. And I'm really glad to be here.
Well, I'm pretty excited to dive into today's conversation because, you do a lot of work around mental health. In fact, you've been recognized for the work that you've done throughout your entire career to help the nation rethink its approach to mental health. It's obviously a big topic and affects all of us in one way or the other. And you're a psychologist, a former policymaker, run the leading scientific and professional organization representing psychology. So I wanted to start by asking you, who are some of the people you have to influence to change the way that all of us think about mental health?
Well, that's a great question because it really boils down to everyone. The fundamental shift that I think we need in our view of mental health is moving from thinking about mental health as about a group of people, those people who have mental illness, and sometimes people even use the term the mentally ill, to really thinking about mental health as something that affects all of us. And in fact, during the pandemic, it was the first time in my career that I really saw the entire population understand that mental health isn't just about someone over there, it's about all of us. And the fundamental shift really comes out of my work in the public sector, where I was working with people who have very serious and challenging problems, often without a lot of resources. So it's kind of counterintuitive that you would think that the best way to help those individuals is to widen our definition of mental health. But the reality is the way we approach this issue is we have to have a diagnosis. We wait until people often are in crisis. And because of that, we don't intervene earlier. The reality is that mental illness is not just about a person or a group of people. It's something that affects all of us. And the best way to think about it is that on one end of the continuum are people who have great mental health, they have great psychological health. At the other end of the continuum are people who are struggling, have very serious challenges. And all of us are somewhere on that continuum. And over the course of our lives, we move up and down that continuum. Sometimes some of us move to the point where we need professional help. But the way we approach mental health is we approach it as a binary issue. Either you have it or you don't. And if you don't have it, then there are literally no resources that can be used to help you. And if you do have a mental illness, if you cross that magical line, then there are resources. And the problem with that is that it really means that we can't intervene at the earliest possible moment, that we don't have resources for people who are at the early stages of their illness, or for people where we can prevent mental illnesses and prevent people from having more serious problems. So that's a big shift in the way we think. And really, to get there, we have to influence a lot of different people. We have to think about policy people who set the policies around what gets paid for. We have to think differently in the field. So all of us who've been trained under that binary model have to be taught to think differently about how we can help people. We have to influence the general public, because general public is very important in a population health approach, because one of the strategies that we employ is this idea of enlisting people from the community to help create psychologically healthy communities and environments. In the same way we think about our physical health, most of us know that if we diet, we do exercise, we do those kinds of things, that we're generally going to be healthy. Those messages are directed at the public, because if we can get the public to do those things, then we can be healthier. And in the same way, we have to do that for mental health.
I have a feeling that when you're talking to the public, a lot of people probably grasp this from a personal standpoint of, this is something that affects all of us. But policymakers and insurance companies and medical professionals, what you're really asking them to do is to change their approach in many cases. And, people just don't like change as a general rule. So as you propose that our country take a different approach to mental health, I wonder if you could talk about how you get some of these different stakeholders on board, policymakers, patient advocates, the medical and scientific community, and how do you use different approaches to influence different groups of stakeholders who, have their own professional focus areas and their own experiences that they're bringing to the table?
Yeah, that's most of my career before coming to APA was in public policy. And so I had to do exactly that. I had to convince a lot of different people from a lot of different perspectives. And what I've learned is that if we're going to be effective at that as a leader, you have to speak a lot of different languages. And so I can speak the language of data, because there are a group of people for whom anecdotes don't help. But there are many legislators, many people who are in influential positions for whom, if you can't tell a story about what you're talking about, they don't quite get it. And so I think you have to talk in lots of different languages, the language of the heart, which I think a lot of times policymakers and people in the kind of positions I was in don't really think about that. We're thinking much more about what does the data say, or can you tell me a story that illustrates this? But a lot of times it's really getting people to think differently about people. It's getting people to see the humanity in on the person who's sitting on the street talking to themselves. It's getting people to have humanity for, the youth who are in a juvenile justice situation who really has a mental health challenge. And so I think some of the stories have to stimulate that as much as it stimulates the thinking that people have. I think another thing that I've learned is that, especially when we're trying to change major organizations or major systems, what I found is that there's sort of this 3-stage process that I go through. One is really thinking about getting people to think differently about whatever the issue is. And to do that, you really have to understand the mental model that people have. Most people, well, all of us have a mental model about everything. We have a mental model about, what it means to be a parent, or what it means to be a psychologist or a psychiatrist. And so if you don't understand what that mental model is, trying to get people to think differently or to behave differently is very difficult. And so a lot of my work is about saying, well, here's the way we've been trained, and ask people, well, given what we know from science and from our experience, what are the problems with that? People come up with a very long list, right? Actually, I've done this even with journalists, and journalists who are not in the field are actually pretty good at figuring out and articulating what some of those challenges are. And then I offer people a different way of thinking of that, around that. But we can't stop there. We have to then take that thinking and help people to understand how is that translated into behavior. And so the next sort of phase, and these are not sequential, they're overlapping, but really begin articulating, okay, if we really believe that, here's how we would behave differently. Here's how policy would look. Here's how our training would look. So really practically what it would look like. And then the third phase, which a lot of people don't recognize when they're trying to change complex system, is you got to change the context. And by that, I mean, it's great that people are thinking differently. It's great that people are beginning to behave differently, but you got to think about the context that's going to support those changes over time. And so as a policymaker, I spent quite a bit of time thinking about, when we did, for example, evidence-based practices, okay, what do we need to do from a policy standpoint to sustain those practices over time? And so some of that had to do with changing our financing strategies and what we paid for and how we paid for things. Some of that had to do with changing how we monitored programs and evaluated them. So it was really trying to change the ecosystem and being intentional about that. And I've found over time that if you're very intentional about going through those 3 phases, you can make some pretty significant change.
I shouldn't be surprised, but I really love that as we're talking about how we change the way people think about psychology, that you went to psychology to solve the problem, and sort of a model to really think about, people's mental models and how they think. So that's very good. I wonder if you could talk a little bit about, you referenced your time in Philadelphia, where you were the commissioner for the Department of Behavioral Health and Intellectual Disability Services. And then you talked about that sort of 3-phase, sort of the overlapping framework. Could you talk about some of the real life examples from that time of things that you tried and things that worked? Because, I understand that during that period, there were some pretty interesting experiments and interesting applications that you were able to put into practice.
Oh, yeah. Well, there were so many things. And I learned so much from the people that I work with. And, I just love that work and the people I work with. I was just thinking about one story of one of the things that I really paid a lot of attention to was making sure that communities and voices that are often not heard or easy to overlook, that we were paying attention to those communities. And in Philadelphia, we have lots of communities like that. For example, the Southeast Asian communities, relatively small compared to the whole population, but significant, often will not come into the traditional treatment system. And so if we want to serve that community well, we have to first talk to those communities and understand how they understand their challenges, and come up with solutions. And so uh, one of the organizations I work with came to me one day and said, look, we have a lot of women in our community who are depressed. They are widows. Their husbands died in the Vietnam War. They're here, they're isolated, and they're very depressed. But what we think that the solution is to do something they call Jook breakfasts, Jook. And what they talked about was, we think that one of the problems is that these women don't have this sense of having having a meaningful role within our community. And what we want to do is to bring them together with kids in the daycare program that was near where these women were going during the day. And so what they asked of me was to fund that. And so we funded those breakfasts. Women started to have these relationships, these meaningful relationships with these children. And what they observed is that over time, what they were seeing in terms of the depression went away, right? So if you were to ask a typical policy person like myself like I was, these women have depression, what is the solution? What we would often say is, well, we need to get those women to a treatment program, and we need to assess them for medication, and perhaps we need to give them medication and then start them on psychotherapy. That would have been our solution. But when you listen to communities and you hear what their understanding of the issue is and their understanding of the solutions, you get some very innovative solutions. And one thing that I want to point about this is we're not just, and again, I'll speak for myself. We were not just sort of listening and only following the lead of the people that we were listening to. We were bringing our expertise as mental health professionals. I knew that was a very interesting but probably effective solution because I know the research around one of the things that drives depression is social isolation. So it's actually a really unique. They didn't understand maybe the science of it, but they understood the community. And so it was those kinds of solutions that I really appreciated and really came out of this way of working with people that recognizes the expertise that people in communities have. And in fact, one of the sayings I have is inherent in every community is the wisdom to solve its own problems. And so when I come at problems that way, what I understand is, sure, I have something to bring as a psychologist, got lots of training, many years of training, but communities also have very important solutions and understanding.
I love that quote, that inherent in every community
is the wisdom to solve its own problems. Yeah.
Solve its own problems. That's good, because one of the themes that we've heard from several of our chief influencers is this idea that if you want to influence others, you have to allow them to influence you, which means listening and which means learning. And you gave a really specific example of that with the Jook breakfasts and how listening to the community, you were able to, say, oh yeah, this is consistent with what I know from the science, but it's a particular application that has a cultural context, and that community was able to, identify a solution there. But you had to allow them to influence you. And I would say that's probably challenging as a policymaker serving a lot of people, is to find the mechanisms to let people share their ideas and to, filter all of that information. I wonder if you could talk a little bit more about that for leaders who maybe want to do that listening, but maybe they're having a difficult time finding the mechanisms to do it the way you did in Philadelphia.
Yeah, I have found throughout my career that having a mechanism, a formal mechanism to make sure that I'm hearing from voices, particularly marginalized communities and voices that you would not necessarily hear, is really important, and actually made me a better policymaker, makes me a better administrator. Today, I made a commitment, although we don't have chapters in the American Psychological Association, we have states who have their own psychological associations who are affiliated with us. And so I made a commitment when I took the job that I would go to every state in the union. I'm about halfway, a little more than halfway. I've been to Alaska, to Arizona, to Wyoming, to I'll be in Maine next week, and I found that to be enormously important in hearing directly from people. And whatever position I've been in, I've asked the question: what is a way that I could have my ear on the ground, listening to real people, listening to, sort of getting out of the bubble that, we live in, especially here in Washington, D.C., where I'm at. What are ways that I can do that? And so sometimes it is those kind of formal ways of going to people, asking people to invite you to things. One of the things that I loved when I was commissioner was that I would go to all kinds of celebrations. I'd go to Chinese New Year, and I would go to the Haitian celebration. I would go to the Cambodian celebration. So I was very intentional about being in their space and the places that they lived, worked, worshiped, and played as a strategy. And I think all of us who are leaders, if we think hard enough, we can think about who those voices are, and we can think about ways that we can engage them. But a lot of times it's doing things that are a little bit out of the box.
Yeah, and obviously there's so much we can do with technology to gather information, but there's also no replacement for just showing up and the conversations that you might have in a room that, picking things up that you wouldn't get from, putting out a poll or a survey, right?
Yeah. Let me give you another example of, talking about reaching and listening to people. If you go to Philadelphia, one of the things you'll see are murals all over the city. And that program is run by a woman named Jane Golden, who's just this phenomenal person. But I was listening to Jane one day, and Jane described, this is early in my tenure in Philadelphia, and she described this process that, these are not a solo artist, on the side of a building. It's actually, they would bring people from the community together. They would talk about the concept, and they would work with an artist, and then they would paint the mural together collectively. And at the time, we were thinking about the issue of stigma and how do we reduce stigma in the community. So I went to Jane. I said, Jane, could some of the topics of the murals that you're painting be about mental health and those kinds of things? And that started a partnership that I think continues today. But we painted so many murals in the city, and actually I funded those projects, and I used them as a way of having conversations with people that would otherwise be very difficult. So, for example, we did a mural on the issue of suicide. If I go to the community and say, I'm commissioner from behavioral health, I'd like to talk to you about suicide, like 5 people would show up and 3 of them would be related to me, right? It's very difficult to have those kind of conversations. But we literally had, hundreds of people who would come and be a part of that. And then that gave us an opportunity to have a discussion that we wouldn't ordinarily have. And, one of the reasons I like that example is that as an appointed political person, tend to play it pretty safe, right? That was pretty risky because I could have easily been criticized for why are you spending money on art, quote unquote, when we have people who need mental health. I saw it very differently. What I saw was we have a challenge. If we don't deal with the issue of stigma, there are many people who are going to continue to die. Many people are going to continue to suffer. And for me, it was worth the risk of doing that because ultimately, I knew that we could reach people that we would not otherwise reach. Now, it turns out, fast forward, we have people literally from around the world that came and people, in other countries now are doing that. But at the time, it was pretty risky because that wasn't sort of an accepted, known way to do it. And I point that out simply that I think if we really want to reach people that we are not typically reaching, we can't do the same things that we've always done and expect a different result. Sometimes it's going to mean taking a risk to reach people that we would not otherwise reach.
Yeah, can't play it safe. Every time you have to experiment. That's a really good example, the how you got so many people involved in the process through the mural around that difficult topic. I wonder, as we talked about some of these in-person interactions, like, showing up to Chinese New Year and bringing together people for a mural, it also got me thinking on the other side how obviously there are more ways for us to engage virtually in today's world. And earlier we talked about how folks don't necessarily love change. During the pandemic, telepsychology became much more prominent just by necessity. Our society had to adapt to staying at home and social distancing, et cetera. And I wonder maybe if you could talk about that topic, because I guess I don't know enough about it to know, is there still more to do? Is telepsychology widely enough adopted now? But, it seems like an area that really wasn't a big thing. And then now, obviously, it's more popular than it was before. And you had to get a lot of people to be willing to change the way that they thought about providing a service or receiving a service or paying for a service if they're, an outside company. So maybe we could use that as an example. And I'd love to hear your perspective on it.
Yeah, telehealth is one of those things that I actually have been surprised at how quickly our field adopted and adapted to that. I have many friends who are still in private practice, and some of them, their entire practice is still telehealth. And these are people that I would have, if I would have made a bet, 5 years ago, would they be, all in on telehealth? I would have said absolutely not. They're too much into the in-person kinds of interactions. And I think what has happened is that we can reach people again that we would not typically reach or would otherwise reach. And I think that the convenience of being able to, not have to do the commute, not have to try to get the kids off to someplace or the babysitter so that you can do your session. Those little conveniences make a big difference in reducing the friction in getting mental health services. I think it is here to stay. We, as an organization, the APA, has been very vocal and advocating for telehealth, and not only video telehealth, but especially audio telehealth, because there are parts of the country, particularly some of our frontier states and some of our more rural areas, that don't have the bandwidth to do visual telehealth, and so we want those individuals to have access as well. And so I think it's here to stay. I think that we have to do the research to make sure that as we're doing this, that it's not compromising the outcomes. Right now, we don't see that. We're not hearing that people have concerns that's the case. But I think we have to follow it and make sure. But for the most part, this has been a huge win for our field, and more importantly, a huge win for people who would otherwise not get help.
Yeah, pretty amazing how quickly people have adapted to some of these changes. And then there's some other ways we probably haven't adapted as quickly as some of us might think. You talked about the role the APA plays advocating, in this case around telehealth. So you're a former policymaker, but now you find yourself in the seat where you are advocating for policy change. And I wonder if you could talk a little bit about what you found is effective when you're trying to influence policymakers and their staff. How did people get through to you when you were a policymaker? And then what have you learned from that experience that you now use to break through the noise when you're trying to influence policymakers?
Yeah, I listen to data. I'm a psychologist. That's the way we're trained. We're trained to look at the science of a issue. So I absolutely want to see that. But I also listen to the stories and the anecdotes. There's so many groups that I supported very strongly when I was commissioner. For example, there was a group called Grands as Parents. These were grandmothers who were taking care of their grandchildren because their children had, most often it was a serious drug problem, or it could have been a mental health problem, or both. And I just had so much respect for and admiration for these women, who was mostly women, who had, raised their kids, worked, most of their lives, and then they were now taking care of their grandkids. Um, you know, I wasn't expecting data from them. What I wanted to hear from them is, how could we help? What is it that you need? Because I knew as someone who had been a practitioner that was a real phenomenon. There was a whole generation of people who were not available to parent because they had these challenges, and so it made sense to me from my own practical experience. But the stories were very compelling. And I think that's true for many policymakers. We do want to hear those stories about how this issue or whatever the issue is affecting people. I also think that it's important, and right now, because the country is so polarized, and you think about a political environment, I think one of the other things that's really important is to be able to speak to different audiences and not change the essence of your message, right? So, I've worked for both Republicans and Democrats in my career as a political appointee. My values never changed. I was very clear about what my values were. How I talked about issues in those different contexts did change. And I think if you're going to be effective, you really have to understand how people think about an issue, what their values are, and make sure that you're connecting the issue to how they see those issues. So I think that's very important. And I think one other thing that I think is really important, and this is something I really started to understand when I worked in government in Philadelphia, because I was embedded within city government. Typically, mental health commissioners are in a different level of government. They're either in a county or a state level. Very rarely will you see a mental health commissioner in a city government. But one of the things that experience allowed me and helped me to understand is how critical mental health issues are in almost every area of government. If you talk to teachers, or if you're looking at children, one of the biggest predictors of whether a child will do well in school is whether they have a social or emotional problem. You talk to the police chief about who are the people who are, the recidivists in the system. There were people who had often behavioral health, either substance use and or mental health challenges. You talk to people in the child welfare system, almost 90% of those families have mental health, substance use, or both, some kind of involvement there. Practically every area of government is affected by this. And so one of the things that I learned was not to come to them and say, well, this is an issue that you have to pay attention to, but let's work together because I know that this is a problem for you. And I think we can come up with some solutions to solve your problems. And so if you're coming into a policymaker or any person that you're trying to influence, what's the problems that they're dealing with? And can you offer a solution that they would not otherwise have? And so I just kind of found that a variety of those strategies were very important, both when I needed to advocate, but I think when people came to me, those are the things that influenced me the most.
Yeah, and you're highlighting that sort of two-way nature of influence there again. You have to know what your values are and stay core to those. And at the same time, adapt the message to the problem that's on their mind and sort of the framing that they may use and find that connection. And sometimes I think advocates, they're so focused on their talking points and, their statistics and their issue that sometimes they forget to listen and to adapt that message. And so I think hearing that directly from somebody who's been on both sides of it is really helpful. I appreciate how you described that.
Yeah, and I think being able to change the message in real time, because a lot of times you'll walk into a legislator or policy person, and you may think you understand where they're coming from, and in the middle of the meeting, it's clear that that's not their viewpoint or their values, and you need to be able to adapt. So you got to know your issues well enough that you can change up when you see that one strategy isn't working or one line of reasoning isn't working.
Yeah, absolutely. One of the things I always, read various versions of folks' bios before I have the opportunity to interview them. And one of the things I noticed looking at your various bios is that at the beginning, the membership of the APA was, I think, like 122,000. And then another version, it was 130,000. 38,000. And now it's at more than 158,000. So congratulations. Obviously, you all have been growing in terms of your membership, but also in your influence. I wondered if you could share some of the lessons that you've learned leading a growing organization.
Yeah, we had declining membership for several decades, actually. And when I came in, the leadership of the organization said that they wanted to go in a different direction. And so we spent about a year just talking to people. What is it that you want? What is it that what's important to you? And out of that came a new strategic vision for the organization. It really came from the membership and from the leaders of the organization. And one of the things that they said, and it was very interesting, you talk to these psychologists, and the thing they said over and over again, we want to use psychological knowledge, psychological science to address the critical societal issues of the day. And it didn't matter what kind of psychologist, what point in their career they were. That was a very strong theme. And what it told me, that was one of the things. There were other things that they said, but that was one of the main things. And what it told me, and what I've seen in the time that I've been at APA, is that psychologists fundamentally, doesn't matter if they're a researcher or a practitioner, doesn't matter, they fundamentally want to improve the human condition. I think it's true of a lot of professions, but in psychology, it is just fundamental. And one of the things we did as a result of that strategic plan was to really have a much more outwardly facing organization. We've been very intentional about looking at what are the big issues of the day that our country is dealing with, and looking at what part of our field or what areas of our field are relevant to that, and how can we apply that knowledge to those issues. And I think it's made a big difference. So when I talk anecdotally to people, as we've seen our membership go up, we've actually had 7 consecutive years of membership growth. And when we talk to people, what they say is, I left, or I let my membership lapse, but the reason I came back is because you took a stand on this issue, or I see that you're doing X, or I see that you're doing Y. So I think that it can be attributed to the fact that we're doing what our membership really wants. And what our membership wants is for us to be out there using psychological knowledge to address critical issues. Let me give you one example of that. You take the issue of social media. Parents, policymakers, people are in schools are trying to figure out what the right policy is for that. And a lot of that is not guided by science. It's kind of arbitrary. You have some policy folks that will stand up and say, well, no one under 15 should use social media. Well, where did that come from? So what we did was we pulled together some of the top people in the country who do research in this area, and we asked the question, what do we know? What do we don't know? What don't we know? And not only that, we summarized that. And historically, what we would have done is we would have done a great, white paper. We would have been well referenced. We would put it on our website. No one would have looked at it. But because our strategy says we're trying to apply these issues, we want that knowledge to be applied, we took the same information, but we repackaged it. We fashioned it around a health advisory for parents. So now you got people's attention. So here's this health advisory, science-based health advisory for parents on this issue that they're struggling with. And not only parents, but policymakers and other people who work with children. And, rather than, 10 people looking at it on our website, literally thousands, probably millions of people had exposure to that health advisory. In fact, it got picked up all around the world. I have colleagues in other countries who picked up on it. And I think it's a great example of how we have to be intentional about translating things that we believe can be helpful to people. And so for too long, what we've done is we've developed these great papers, and they're, well researched and that kind of stuff. And we're talking to ourselves, right? And so the change that I think we've made in saying we need to go that next step and say, how do we take this and make it usable for people, has made a huge difference in, I think, how people feel about being a part of the organization, and and our reach to people that we really want to help and affect.
Thank you for sharing that example. I actually want to dive into it a little bit more because many years ago, there was an article in the Washington Post about how the majority of the white papers and reports that were published by the World Bank had never been downloaded even once by anybody. It was a pretty sad, it was kind of a funny story, but a sad story too. And, a lot of organizations like yours that are focused on research and science, they do exactly what you sort of said. They do a white paper, they do a PDF, and then, it just sort of goes and dies somewhere. And in this case, you used a health advisory as a way to spur conversations. And in fact, in my role as chairman of the National Digital Roundtable, we even had a roundtable discussion where we brought advocates and social media companies together in partnership with your colleagues at the APA to talk about that health advisory. And so it sparked some real conversations that people found helpful. And so there's kind of two things I want to ask you about that. One is when you do take a different approach, how do you know it's making an impact? What are the questions that you're asking your team? What are the metrics that you're looking at to know that it made an impact? You alluded to it a little bit, but I want to go deeper on it. And then the second I'm wondering is when you do kind of stray into a controversial topic like that one, where there are people on, various sides, how do you approach that and think about when and how the APA should wade into those controversial topics and, when's the right place to do it and how to do it? So that was kind of a lot of questions, but on the impact side and then wading into the controversial topic side, I'd love to hear both of those.
Sure. From an impact side, we look to see, are people using the information? Are people interested in the information? So one metric we look at is or media mentions. So we put this out as a health advisory. Does the media think it's important? Well, it turns out that literally hundreds of articles were published. We got calls from all of the major media outlets. So from that metric, we knew that there was some interest. We also have developed some great partnerships with some of the tech companies, with the Googles of the world, and with some of the other tech companies who wanted to use that information in their own policies and the way that which I think was a huge win, because ultimately, if you look at the report, you say we can't put this all on parents. There are things that the tech companies can do, and we formed some great partnerships because of that. So those are just some of the ways. Are people using the information? Is it getting disseminated? What are the sort of the next steps? How does it evolve? Because I think if it's a good product, a good service that we've put out there, it's going to continue to evolve over time. And in fact, what we did was an update to the first one. We just did that a few months ago. And again, there was a lot of interest in the update. And then the second part of your question about where do we weigh in, there are a couple of things that we have to have as prerequisite. One is, do we have a policy on the particular issue? So our organization will never go out and speak on an issue if our governing body hasn't looked at the issue, and this is a fairly large governing body with dozens of people, to weigh in and say, here's what our position should be as an association. Secondly, is there science on that? And we don't speak out on issues. There are a lot of issues that we'd like to speak out on, but if we don't have a scientific basis to speak out, we won't do it. And then the third thing that I've really emphasized as CEO is, do we have anything unique to say? Because there are a lot of issues that, the science may seem that it is, quote, common sense, right? And sometimes it is, and sometimes it's counterintuitive, right? So it's the science actually says something different than what people generally think. But a lot of times it's not. And so we don't want to use our political capital saying the things that other people can say. So we always try to look at it from a unique perspective. And I think that kind of keeps us in a lane and helps in terms of that.
Yeah, that framework approach, I think it's really good to hear, to help make decisions, particularly on when to weigh in on something that like you say, others might be doing it, and you have to kind of choose where to focus your energy. So that makes a lot of sense.
Yeah, and let me say one other thing that I think is really important, especially as we're in this political environment right now. We always try to be nonpartisan, apolitical in our approach. And we're human. Sometimes something will happen, and administration will do something, and we want to come back pretty hard. But we believe that if we want to have long-term credibility, we got to take the emotion out and say, here are the facts around this issue. And sometimes that can be challenging, particularly on some issues.
Yeah, that definitely makes sense. I want to ask you about something, which is, the APA advocates for a psychologically healthy workplace. So you must get asked, okay, so, if you want other organizations to create a psychologically healthy workplace, what exactly are you doing inside your organization to lead by example? So I wonder if you could talk a little bit about what the workplace culture is like, and, how has that changed, especially in light of the pandemic?
Yeah, well, it's changed. I would say that even after the pandemic, it has improved in lots of ways, and I think it's improved because we've paid more attention to it. Frankly, I think we did a good job, and in fact, my predecessor re- received, or the organization received the award when my predecessor was in, as this being one of the best places to work in Washington, or some award like that. So I think my predecessor sirs really helped to establish a good culture. One of the things that happens at APA is that when people leave, many of them will come back. They'll go other places. They want to come back to APA. We call them boomerangers, so they come back. And I think that that's a good indication of what the kind of culture that people have tried to set here before me. And I've tried to build on that. One of the things is, again, sort of the listening and making sure that we have ways of doing that. And we do that lots of different ways. We survey our staff quite often. During the pandemic, we surveyed our staff probably 3 or 4 times a year at least. We would ask them questions. That's actually consistent with psychological science, because one of the things that we know from psychological science is that if you can help people have a better sense of control over their environment, and one of the ways to do that is to ask them their opinions on things, that people feel better about the work environment. So, we survey our staff quite a bit, which is very important. We do things like mental health days. And when we do mental health days, what we do is I will send out a message that says, you guys got to stop working, because, we have a lot of people who are very motivated, and if you give them a day off, they will see that as a day to catch up. And so I have to tell them, no, this is really, you gotta take a break. And we talk about, the science around why it's important to take a break and all that stuff. But it's very interesting. A lot of the staff will write me a note and say, I appreciate the days off, but I really appreciate you sending the message out, because, I don't get incoming from other people on those days off. And so it really tries to set the tone in the organization. We do all kinds of other things. We have this program called Nectar, where people can give, compliments and kudos to their colleagues, again, because we know that is important. And so they're just these kinds of things that signal to people that we do care about you and your work, but we really care about your health. And I'll give one example during the pandemic that, in retrospect was, I think, a really good strategy. So during the pandemic, you remember in the early days of the pandemic, we weren't sure when we were going to, quote, return to work and people were going to go back.
It's always just a week or two
It's
away.
only
For a
just
long
a
time.
week. Yeah, you remember that? Yeah, it's like, okay, we got this. We're going to be back in the office next month. And what we did was, during the pandemic, we said that if we were going to return, here's the date that we were going to return. And it would always be a date after the, we tied to the school year. So it would either be at the end of Christmas, or if it wasn't at the end of Christmas, it would be at the end of the spring semester or spring terms for kids. And what that did was it took a whole level of stress off of parents, because they didn't have to me thinking, well, am I going to end up having to go back in November? And now I got to figure out what I'm going to do with my kids. And
Yeah.
so that came directly from listening to people, actually looking at the data, the national data, which said that one of the groups that was the most stressed during the pandemic were parents who had small young children. And so when we thought about how we messaged and communicated to people, we kind of incorporated that. And again, that was one of those things that people really appreciated because it just took a level of stress off them. So
Yeah.
it's sort of a range of things. And, I think for the most part, people appreciate that kind of attention.
Those are great examples. I love hearing about the things you're doing inside the organization, and obviously a learning organization where you're listening and you're adapting, and but especially hearing directly from the CEO. When we say take that day off, I really mean it. That goes a long way. So that was a really great anecdote that I think people can take that and apply that immediately. I know we are coming to the end of our time here. I wanted to just ask you one more question, which is, how do you think that the APA and its membership will evolve over the next decade? And I'm wondering how you're, planning to ensure that your organization continues to influence the conversation on the issues that matter going forward.
Yeah. Let me start with the last part of your question. How do you ensure that we continue this? And I think it's that we have to build infrastructure in the organization to have that outward focus. Organizations are wonderfully designed to get the outcomes that they get, right? And so if you want different outcomes, you have to have a different organization. And one of the things we've been very intentional about is asking ourselves the question, if we really are going to be a service to humanity, how do we have to change internally to do that consistently and at a high level? And that's everything from how can we build mechanisms in the organization to quickly summarize the research? Can we build mechanisms to get multiple perspectives on a complex issue in a very quick way? Do we have mechanisms to get our messaging out to the people who are most influenced? Those are all things that we have to be very intentional about. And I think, one of our past presidents back in 1968, a psychologist named George Miller was president of the association. He said, look, we ought to be about giving psychology away. And one of the things I did when I came into the position is I kind of looked at statements that presidents had made over the years. It was very interesting that most of the presidents of APA made a similar statement. And it really got me wondering, well, why, over all of these years that people kept saying that, but apparently not feeling like we were doing that. And I think that the difference is that when the leadership of the organization said, this is the direction that we want to go, and the members said that, and then we built an organization to actually deliver on that, we were actually able to do that in ways that we hadn't done historically. And so I think that that's a really key ingredient to whether we are going to be able to continue. And the other part of that equation, obviously, is to having people in leadership in the future that also care about the things that, the current leaders in the organization care about. And how we grow over the next several years, I think will depend on those things. But if you ask me what I would hope that we would continue to diversify our organization so that the organization reflects the country, both in terms of gender, in terms of race and ethnicity, in terms of geographic area of the country. I hope that we will have an organization that reflects the country in terms of political ideology. That may not ever happen because psychologists tend to lean a little left. But I want to see more people who are on the right side of the political spectrum in our organization and having voice. I think it's important. I want to see people from different parts of the of our field, not just clinicians and academics, but people who were like myself, who I really identified as a psychologist, but I was in environments where I wasn't identified as a psychologist.
Right.
People didn't think of me as a psychologist; they thought of me as a commissioner or politician or now political leader or whatever. And a lot of times those people sort of drift away from our field. We need those people on the inside of APA as much as the people who are every day identifying as psychologists. So, those are just some of the ways that I would like to see us continue to grow and evolve, and hopefully, we'll continue to do that.
That's wonderful. I think, yeah, your point about building the infrastructure to accomplish those things that you describe, right? It's one thing to say it, but really influence when you have a large organization and a large membership is building those structures to make it happen. I have to ask you one quick bonus question. I always love it when we talk to a chief influencer who, maybe has been inspired by another one of our guests. And you and I were talking about how you'd listened to our episode with Terry Zuplatt, former speechwriter for Obama. I wondered if you might just say something about that.
Well, I think to be a good influencer, you have to communicate, and I spend a lot of my time doing public speaking, and people are always surprised that I still get nervous. I still fret over my talks. What they don't see is it's like the duck on the water. Looks calm on the surface, but underneath, the feet are going. That's probably me when I speak. And in fact, when I was in college, I was so nervous, like many people, and afraid of speaking, that I just couldn't do it. And so if you would have told me then that I do as much public speaking as I do now, I would say, no. So when I heard your talk, I was like, okay, this is another opportunity for me to kind of hear from someone who's like really good and work for one of the best worders of our time. What can I learn? And so I leaned into that, and I picked up a few things that I'm going to be employing in my next speeches.
That's great. Well, I hope you enjoy his book. And one of my favorite things that he shared, I think it was in the Q&A of that, was he reminded us that President Obama, when he was younger, really was a nervous person who struggled with public speaking, and that only later did he, because people see that first speech when he came sort of onto the scene, and they think, oh, he must just be a natural gifted, person. But he said, no, he really struggled with it too. And I think it's helpful for all of us to hear that. It shows that we all can grow and evolve in different things, even in public speaking and communication.
Yeah. No, absolutely. So can I tell you one thing that he said, he talked about, and I've kind of incorporated this, he talked about hope and how important that was in speeches. And it's something that, given the topic of your podcast, that I have found to be enormously important is the issue of inspiration. So much so that whenever I write to my staff, I sign off by saying stay inspired, because what I found that if you can connect people to what really their why, it makes a huge difference in how they feel about the work and how they're motivated to work. And so that was a direct connection to, just the way I think about the work of being a leader in an organization. It's not just about getting people to do things. It's about people feeling good about the work that they're doing and understanding how it's making a difference in people's lives. So.
I love that. That is such a great way to sign off when you're sending a message to your colleagues. Stay inspired. I'm leaving this interview with you inspired. I wish we could talk for a couple more hours because, your career, Dr. Evans, being a psychologist, being a public servant, leading such a large organization, you shared just some really great lessons that you've learned across your career. The importance of speaking different languages with different people, listening to them, knowing what's going to be important for them to hear, but at the same time, staying true to your values as doing that. And that really kind of goes with our theme of two-way influence. How you have to allow others to influence you if you want to influence them. I loved how you got the community engaged with the murals with your colleague Jane Golden in Philadelphia, and that was part of tackling stigma around a challenging issue like suicide, but getting people really engaged to make a difference. And I also just thought it was really great to hear how you communicate with your own team when the organization says you have a day off for mental health, that you send a note that says, we really mean this, and that you've heard back from the team that has worked for them. And they get fewer emails, and they're able to really unplug when you want them to. So just some fantastic lessons from you today. Thank you so much for sharing your story with us, and we're just so happy to recognize you as a chief influencer.
Well, thank you. I've really enjoyed our talk.
Thank you for joining us for another episode of Chief Influencer, a production of Social Driver and the Communications Board. If you know a leader who should be featured as a chief influencer, please nominate them at chiefinfluencer.org. For show notes and more, visit us at chiefinfluencer.org or follow Chief Influencer on LinkedIn. Until next time.